To understand childhood anxiety, we should first learn the difference between phase and disorder, which is basically that the phase of worry would be temporary and it would be usually harmless. Um, Children who suffer from an anxiety disorder experience a lot of symptoms like fear, nervousness, shyness, and then there will be avoidance of places and activities. All these symptoms may persist despite that they are getting help from their parents, caretakers, and teachers. So basically, worry would come and go, but anxiety disorders tend to become chronic and they interfere with how the child functions at home or at school. The interference would be to the point that the child becomes distressed and uncomfortable and starts avoiding activities or people, and it would be hard for the child to carry out daily activities. According to 2018's Children's Mental Health Report, um, there has been increasing recognition of anxiety in young people by healthcare providers. The diagnosis has increased to 17% if we compare it with 10 or 15 years ago. Even though anxiety diagnosis is um, increasing, but the symptoms of anxiety are minimized or ignored, and this causes a huge gap in treatment that is received for childhood anxiety. And as little as 1% of youth with anxiety seeks treatment in the year their symptoms begin. And overall, 80% of children with anxiety do not receive care. Prevalence of anxiety disorder. So, international studies have shown that the prevalence of any anxiety disorder was 6.5% in children out of all the other mental health disorders. CDC states that 7.1% of children aged from 3 to 17 years have been at least diagnosed with anxiety once in their lifetime. And CDC also noticed increase of the diagnosis of anxiety from 5.5% to 6.4% from the year 2007 to 2012. And um, Anxiety has surpassed depression as the top complaint among college students seeking mental health services. Even we can see in the graph over here that anxiety is found more than depression and behavioral disorders. And also, if we take a closer look, we can see that it increases with age. There are many types of anxiety in children and adolescents. First of all, in separation anxiety, children fear getting separated from caregivers. In social anxiety, children are excessively self conscious. In selective mutism, children may not speak in specific settings, like maybe at school. In generalized anxiety, children may be perfectionist and worry about daily activities or things going on in their lives. Then there are specific phobias that can be related to closed spaces or spiders. Then there are panic disorders where children might have feelings of having panic attacks where they feel like they're dying or having a heart attack. Until recently, obsessive compulsive disorder and post traumatic stress disorder were also classified as anxiety disorders. Now they have been moved, post traumatic stress disorder has been moved to trauma related disorders. And this was really interesting to me that recently mental health professionals have been observing COVID related anxiety in children. There are many contributing factors towards it. Children were separated from regular social interactions and they had to live with the new normal and base their interactions on safety protocols defined for them by CDC. And I think children in the as they are already anxious beings, then the masks limited their ability to read social cues, and the worry being transferred to them by parents, media, and school. So these all factors contributed to a surge in anxiety in children. So, this will be one phenomena that we will have to keep an eye on as mental health professionals. Overall, the prevalence of these anxiety disorders uh, is shown in this diagram, and we can see that specific phobias are is the biggest chunk of anxiety disorders found in the young generation. And then there is social anxiety next, and after that there is separation anxiety, and that is 8%. And then out of total diagnosis, 2% is generalized anxiety, and then panic disorders. These are some biological and environmental factors contributing to the anxiety disorders in children. You can take a look at them. Anxiety can present itself in many different forms in children. So, changes in mood can be observed through irritable behavior or unhappy a mood. Cognitive issues can be seen in children through concentration difficulty, ability to focus is affected, and then they might have poor memory retention. Behavioral changes are also observed in children because of the avoidance in behavior, withdrawal, or trouble relaxing, or taking too much charge of things to control the situation. Then there are physical changes such as headaches, belly aches, disrupted sleep, tense muscles, and there are multiple other physical symptoms like racing heart, nausea, dizziness, shaking, sweating, etc. Anxiety rarely occurs alone. It can exist with physical issues as well as mental health issues. Some of the issues can be caused by anxiety, or sometimes anxiety can be caused by some of these issues as well. Studies have shown depression and eating disorders often co occur with anxiety disorders. Adults with anxiety disorders report experiencing disturbing anxiety as children. Studies have also shown that childhood anxiety is a strong predictor of an disorder in later stages of life. One important factor to keep in mind is that all these factors that coexist with anxiety can sometimes also be misdiagnosed with anxiety. Um, for example, for physical issues, asthma can be misdiagnosed instead of panic disorder. Similarly, the heart disease can be misdiagnosed instead of a panic attack because of the similarity of the symptoms. And in case of mental health issues, learning disorders will be a very good example that can be misdiagnosed in place of anxiety, when anxiety is the one that is actually preventing a child from learning or showing what they know. Um, Another good example would be ADHD. The distraction can actually be caused by the internal worry and fear that comes with anxiety disorder, but the child is likely to receive a diagnosis of ADHD. Autism is one very good example. Children who have a very early on social anxiety can have behavioral inhibition as selective mutism and poor social skills. So this can all confuse professionals sometimes, and parents or caretakers, caregivers. So this can also suggest the diagnosis of autism instead of social anxiety.
Now we are going to talk about what the literature says about how play therapy specifically relates to treating children with anxiety. We will look at the following three areas: treatment modalities, theoretical approaches, and effectiveness of treatment. In terms of play therapy treatment modalities, a study performed by Silva et al. In 2017 showed that various play therapy modalities were effective in significantly reducing anxiety on pre and post operative pediatric patients in hospital settings. The successful modalities in the study included storytelling, role playing games, coloring, Play Doh, painting, doll play, and even video games and cartoons projected on the ceiling. Likewise, a study by Fu et al. In 2020 supported the mode of sand play therapy as a multisensory play therapy treatment that successfully reduces anxiety ratings in individuals with generalized anxiety disorder using the Hamilton Anxiety Rating Scale and the General Anxiety 7 scale. In addition to these various modalities, the delivery of play therapy in both individual and group therapy modes have each been shown to be effective means of helping alleviate symptoms of anxiety in children and adolescents. Encompassing these play therapy modalities are two main theoretical approaches: non directive theoretical approaches and directive theoretical approaches. Both non directive and directive approaches to play therapy each show promising results in the treatment of anxiety. The non directive theoretical approach of Gary Landreth's child centered play therapy allows children to take the lead in the playroom and to address their most pressing concerns first. Children who receive child centered play therapy also learn to take responsibility, to make decisions, and to develop positive self esteem in a dedicated private play space with an empathic and relational therapist, thereby increasing self esteem and decreasing anxiety. And you can see this non directive theoretical approach represented by the left circle in the Venn diagram. On the opposite spectrum of a non directive theoretical approach, as shown in the right circle of the Venn diagram, is cognitive behavior play therapy, which follows a directive theoretical approach. Cognitive behavior play therapy combines cognitive treatments that help combat faulty thinking with directive play therapy techniques, wherein the therapist chooses activities and treatments that direct clients to ways that help them process their thoughts, feelings, and behaviors. It also helps them foster developmentally appropriate social skills. Because young children cannot always express their thoughts and emotions through verbal communication, cognitive behavior play therapy is not recommended for children younger than age 8. But for older children, it is a relatively successful directive play therapy approach that helps upper elementary through high school aged children develop more adaptive thoughts and behaviors. In contrast to a completely non directive or directive theoretical approach, Adlerian play therapy combines both non directive and directive approaches and is the first of the play therapy applications to be labeled as evidence based by the Substance Abuse and Mental Health Services Administration. Adlerian play therapy begins with the therapist using non directive techniques and then, in subsequent sessions, gradually transitions toward a more directive approach as the child progresses through their four-stage treatment phase. While its effect on anxiety has not been determined specifically, Adlerian play therapy has been found to be effective with children who have externalizing behavior problems and self esteem issues, which often lead to anxiety. And you will see that the Adlerian play therapy is in the center of the Venn diagram because it is encompassed by both non directive theoretical approaches and directive theoretical approaches. Even though different play therapy modalities and theoretical approaches have been used to treat children for various presenting issues, there is a scarcity of research directly pertaining to play therapy's general efficacy in treating anxiety in children. In fact, most research on play therapy and anxiety only depicts smaller, specific populations. And yet, some studies simply generalize children's emotional and behavioral issues to include anxiety. However, in spite of the limited research focus on anxiety in children, there are some studies that do show promising results for play therapy as a treatment for anxiety in children and adolescents. In 2004, a study published by Jennifer Baggerly showed that play therapy had at least moderate effects on 42 homeless children between the ages of 5 and 11 who also had anxiety. In a 2013 study, therapeutic play combined with music, art, guided imagery, massage, distraction, and other modalities showed moderate to extremely high effect sizes for pain and anxiety in children undergoing cancer treatment. Likewise, in 2019, a study was published in Seoul, Korea, that examined the effects of child centered group play therapy on the improvement of withdrawn preschool age children levels of anxiety, daily stress, peer interaction, and EEG variation. Overall, the results showed that those who received child centered group play therapy exhibited decreases in daily stress and anxiety and increases in positive peer interaction and emotional quotient scores, compared with children who also exhibited anxiety symptoms but received no treatment. Overall, even though there is limited research about the use of play therapy to specifically treat anxiety in children, studies thus far have provided some encouragement and confidence in play therapy as having moderate to strong efficacy in treating anxiety in children and adolescents.
Okay, so I'm going to be going over some of the ethical and cultural considerations when it comes to providing play therapy to children with anxiety. So, ethics in play therapy can be pretty complicated, as we all know. So, when administering play therapy, obtaining permission from the parent should be at the top of the list of things to do. The first thing I'm going to discuss is informed consent. The text states that parents must be informed about the purpose and process of play therapy and have been administered an appropriate informed consent. Not only is informed consent required, but it also helps the overall relationship with the therapist and the client, or in this case, also the client's parents. Confidentiality is another big ethical consideration when it comes to play therapy. When discussing confidentiality, most younger children are not very concerned but should still be informed anyway. The text states that older children are more socially aware, therefore, they may have more of a concern of that information that they provide to the therapist. As the therapist, it's your responsibility to inform the child that it is a safe space for them, and whatever they tell you is to be kept in private unless the child is in danger or the child wants someone else to know. This is also a very important point to remember when working with children who suffer from anxiety. Anxiety tends to bring along worry, which may cause the child to worry about what the therapist may say to other people, which is why it's crucial to remind the child that what they say and do is to be kept confidential. Another main point I'd like to touch on here is a professional consultation. Consultation is extremely important in counseling when making ethical decisions. Counselors are faced with many different ethical dilemmas, and determining the correct course of action can be very difficult. There is most likely going to be instances during all of our counseling careers where we're presented with an ethical dilemma and we may not know the correct path to take. This is where professional consultation is going to come into play. By discussing the issue with another professional, it's going to help you be able to get a different perspective and also hear from someone who has possibly dealt with a similar situation. The final ethical consideration I'm going to discuss here involves competence. The play therapist should be knowledgeable of the key theories of child development. Understanding the clinical needs for specific groups of children are important because they allow the therapist to draw on theories of attachment, mental health, and well-being. Children who suffer from anxiety may experience a high amount of paranoia, agitation, restlessness, and other negative symptoms, which is why it's required that the therapist be fully competent when administering play therapy to children with these specific issues. All right, now I'm going to talk about some of the cultural considerations involved with play therapy and anxiety. It's important for the therapist to be aware of the ways in which anxiety is perceived by children of different cultures and backgrounds. A child's personal background influences the way they experience emotions. Different cultures have different beliefs about the physiology and psychology of human nature. Therefore, anxiety can be perceived in many different ways depending on the culture you're working with. The selection of toys is another cultural consideration I'm going to discuss. When working with children who experience anxiety, certain toys may be helpful for some of the symptoms they're experiencing. Fidget toys have been known to be self regulation tools that help with focus, attention, and calming. Fidget toys include things like stress balls, fidget spinners, bendable sticks, and malleable putty. These toys also allow the child to have a sense of control, which may not be something children with anxiety experience very often. The final cultural consideration I have here is awareness. By awareness, I mean awareness of one's own cultural views and biases, of the client's worldview, and of culturally appropriate intervention strategies. Before entering the playroom, the therapist must be aware of any cultural biases or values they possess. The therapist must also be aware that their client's worldviews may be different from their own. Lastly, it's important to be aware of culturally appropriate intervention strategies. By this, I mean that a culturally appropriate counselor should respect the client's religious views, family dynamics, values, and beliefs.
Consultation recommendations the play therapist may make to caregivers regarding a child with anxiety is number one, to be patient, to listen, and be engaging. It is of great importance that parents embrace CCPT for their child. If the child feels the parents are supportive of this therapeutic modality, the child will be more receptive. If the parent is looking for more information about play therapy or specifically looking for a play therapist, we have included resources at the end of our presentation. It is also a good idea for parents interested in play therapy to reach out to their pediatrician or to their insurance company for referrals. As CCTP allows the child to lead and play, it is important, particularly if a child is experiencing anxiety, that the parent work to facilitate an environment in home life where the child feels empowered to make decisions, particularly in play. For young children, this can be as simple as allowing them to choose what movie you watch, what game you play as a family, or what your family is having for dinner. Garcia and O'Neill 2020 illustrated in their research that play therapy and good family cooperation can minimize and reduce both anxiety and stress in children. Because caregivers are often the most influential individuals in a child's life, it is important that the caregiver listen to the child, empower the child, and offer love and a feeling of security. Set a time each day to really connect and listen to your child. Children want to be seen and heard. By empowering your child and listening to them, you are doing this. Consultation recommendations for educators. It is important that teachers and educators be supportive of CCPT within the school environment. Because school is oftentimes a major stressor for kids with anxiety, facilitating this modality of therapy within the confines of school is a wonderful thing for children with anxiety. It is important for educators to be mindful of the environment within his or her classroom, making sure this is a warm space where everyone is heard. Teachers also want to make sure it's an inclusive environment where all students have the right to be respected. Offer various communication tools for students, particularly those with anxiety. An example of this would be a worry box, town hall, email, or private time each day to speak with the teacher. Having fidgets and other manipulatives readily available for all students within the classroom can also help with anxiety. Provide plenty of fresh air time and time to get outside of their desk and wiggle is also a great idea. Many education systems have found allowing students extra time on tests as well as open note exams alleviates a great deal of test anxiety and enhances performance ability for students.
So, our first directed play therapy activity is called Macaroni Worry Cards. Together, you create a list of things that the child is worried about. Next, you have them or you, depending on their age, write down the worries on a note card. You write each of them on their own separate note card. After all of their worries are written down, you lay them all out on the floor. Then you give the child a bowl of dried macaroni noodles. You tell the child that they can use as few or as many noodles on the cards as they want. The only rule is that the more macaroni noodles they use, the bigger their worry is. After they are all finished placing the noodles, you go through each card and reflect on how big or how small that worry is, depending on how many noodles they assign to each card. This exercise helps the child feel heard in their worries, and they will also have a greater awareness of the size of their worries. So if you break it down to, oh, well, this worry has one macaroni noodle versus this one has 10 macaroni noodles, I see that this one is a much bigger worry. It helps them kind of visualize how much they worry about that in their head. Our next play therapy directive approach is called wet noodle, dry noodle. So, first, you ask the child to make their body tight and straight like a piece of uncooked spaghetti. You can tell them to glue everything together and squeeze tightly. Then, you have them breathe slowly in and out through their mouth. Ask the child how they feel. Next, ask them to relax their body like a piece of cooked spaghetti. You can tell them to wiggle their body around, make it loose and bendy like a piece of cooked spaghetti would be. Have them breathe in and out slowly through their nose again. Then ask them how it feels to be relaxed after being so tight and so tense. This helps the children to experience what it feels like to be stiff versus what it feels like to be relaxed right after one another. So you discuss with the child how anxiety can make them tense up and how to identify when they're feeling tense. So through this practice, if they keep making their body straight and tight like a dry noodle, the more they do that, the more they can see what it feels like to be tense, and the faster they can identify that when they're feeling anxious. And so, this technique creates somatic awareness and it consciously directs the body to soften and relax. If you do this enough times and you have them relax after they're super straight and tense, then it will naturally kind of help the body to relax after it starts to feel tense when they're being anxious. Here are group discussion questions that you will have a chance to respond to for the discussion portion of this module. We hope that this presentation has been helpful, and if you have any questions, feel free to contact any of our group members. Thank you for watching and participating.